Hello, I am Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, IVFcentre Pune. Today, we are going to discuss a very important topic in test tube baby. Do all embryos which are formed in IVF give pregnancy? Now, generally, what the patients and their relatives think is that they are unable to bear a child, they are unable to form a baby, and once we form a baby artificially with the help of ICSI machines or IVF technology, that's about it. Now, this is a very important misconception which has to be ruled out. Whenever we are making a test tube baby, we are trying to make an embryo by taking the mother's egg, which is called as the oocyte, and mating it with the father's sperm or the husband's sperm to make an embryo. Now, once this embryo is formed, we culture this embryo in an environment which is absolutely similar to the mother's womb, pertaining to the temperature, pH, or the conditions which are exactly similar to the human uterus. Now, this embryo which is formed needs to grow further and establish itself that it is survival of the fittest and of a good quality, good differentiation, good cellularity to be able to actually give a pregnancy. You will be surprised to know that whatever embryos are formed, only 30 to 40% of the embryos can actually give rise to a successful pregnancy and go till term and deliver at 9 months. So, whenever an embryo is formed, you will receive an embryo record of which only the top quality embryos, which are generally 5AA, 5AB, 4AA grade of embryos, which are very good quality embryos, can be frozen. It depends on the hospital's protocol, and only the top quality embryos can be transferred by a frozen embryo transfer technology to be able to give a good success rate. Average or inferior quality embryos, even if they are formed, may not give a pregnancy. On top of that, they might result in unwanted things like miscarriages or certain abnormalities, which is a too big risk to take. And hence, when your doctor discusses with you regarding the grades of the embryos, make it a point to ask her to freeze only the best quality embryos so that you get an uneventful pregnancy and a healthy baby and a healthy child at the end of the day. Thank you.